You are watching McLaren Port Huron Today's Health Program, and I'm speaking with Karynn Carrell, the McLaren Hospice Volunteer Coordinator, about hospice care. Karynn, thanks so much for joining us today.
Thank you for having me.
I think everyone kind of has an idea of what hospice care is, and they tend to link that with someone with a terminal illness. But can you tell us what hospice care is?
Sure. Hospice care is a model of care aimed at treating a patient's physical, psychosocial, and spiritual needs while they're dealing with a terminal illness. It also aims at making sure that their family is taken care of, and our philosophy is aimed at making sure that everyone is comfortable, the patient and the family. We focus on pain and symptom management, ensuring that they can have the maximum independence and utilize our services to live life as full as they can towards the end of life.
That's wonderful. So a lot of different choices for services then as well?
Absolutely. So we offer, our interdisciplinary team encompasses our nurses, our social workers, chaplains, and volunteers. We can also utilize our massage therapy or pet therapists as well.
Well, that's wonderful. A lot of people think that hospice is just just the end of life, but really it's a longer time frame, or it can be a longer time frame. Is that right?
It is, yeah. So a person who can sign on to hospice, that prognosis is typically 6 months or less.
Oh.
And so the earlier you can sign on, the better.
Right, I can imagine, because as you said, addresses all of those needs that they could encounter.
It does,
Right.
and as well as their families.
Yeah, that's important as well. So I've heard a lot about palliative care. So can you tell us the difference between palliative and hospice?
Sure. So palliative and hospice care both aim at keeping a patient comfortable. Palliative care can start with a patient's chronic illness, and it can go throughout that treatment. It also assists that patient and the family in navigating treatment during It also assists that family in navigating treatment, a confusing medical system a lot of the times, and it also helps them figure out the best living situation for them as well. So palliative care supports them during that chronic illness, while hospice provides care for when that patient has decided to discontinue treatment or treatment is no longer an option for them. And as I said, that prognosis is typically 6 months or less.
And I know just from experience, like hospice isn't always removing everything. It's really keeping things in place that keep them comfortable. That's really the main goal, right?
Exactly. So the goal of hospice is also to keep them as independent as possible, as well as keeping them comfortable during that end-of-life care.
Now, is hospice care covered by most insurances?
It is. Medicare, Medicaid, and most commercial insurances typically have some sort of a hospice benefit, and our McLaren team could help you find out what benefit you or your loved one may have.
That's important. Now comes the question of when do we start talking about hospice? Because I know as people are, getting that chronic or maybe terminal diagnosis is probably a better word. That when do you start to talk to people about it?
Sure, so the earlier the better, and that conversation can be hard from both the point of the patient as well as the caregiver. You want to have that conversation early on so that as a patient your wishes are met for what you're looking for at end of life, and as a caregiver, providing that care to a terminally ill or chronically ill patient can be overwhelming. So the earlier that our hospice team can provide you with some support and assistance, the better that outcome can be, because while hospice is not a 24-hour or round-the-clock care, we can definitely provide you with all the assistance and support that you're looking for at that time.
And I think it's probably even important to start even some conversation before someone is diagnosed, just as you're aging, talk about what your wishes are.
Absolutely.
Yeah.
And I think it's something that, shouldn't be awkward. It should be a comfortable conversation, knowing that your loved one's wishes will be met at that time.
So can hospice care be delivered in a variety of different settings?
Absolutely. So hospice care is provided anywhere that our patient calls home. So whether that be at their home, a loved one's home, or even a facility, our services can be provided throughout all different settings.
That's wonderful. So it's provided by a team, correct? Can you tell us about the hospice care team?
It is. We call it an interdisciplinary team, and it's made up of our registered nurses, our certified nursing assistants, social workers, chaplains, and volunteers.
So it really can address a variety of different areas that a patient might need.
Absolutely. We really want to make sure that that patient and family feel supported.
It's wonderful. You mentioned volunteers, so can you expand on what is the role of a volunteer in hospice care and what kind of things are they doing?
Sure. So a volunteer provides a very important role in hospice care. When it comes to the patient, they are helping to provide some companionship and make sure that they don't feel social isolation towards their end of life. We really want to make sure that they look forward to some companionship visits for our volunteers, and for those individuals who are going in and visiting our patients, they can do things such as play games with them. They can read them a book, or even provide just some supportive presence just by sitting there. In terms of family, when you're at home, those caregivers may need some breaks. They need to carry on with their day-to-day life, so our volunteers can go into a home setting and they can provide a little bit of a relief break for those caregivers. It allows the caregiver to run errands, to make some appointments if necessary, or even just have a little bit of a break that week. So they do such a variety of things.
Wow, that's wonderful. And you probably kind of find out a little bit more about the volunteer and what, if they have some special talents or things, and try to utilize that.
Absolutely. In addition to being paired with our patients, our volunteers can also help with administrative tasks. We have events that we can have volunteers help with, and we also have some sewing groups that we utilize volunteers for.
Wow. Do you have some areas where you really need some more volunteers?
Currently, we have a need for volunteers in every area. Anywhere that you have a passion, we would encourage you to reach out to myself and see where we could utilize you within our McLaren Hospice.
That's wonderful. Is there a big time commitment, or is it really up to the individual?
It's completely up to the individual, whatever they're looking for. So that would be a great way for the two of us to utilize a partnership, as kind of what that volunteer is looking for, where their passion is, as well as where I have a need that would fit within to the time frame that they're able to volunteer, whether that's weekdays or weekends, daytime or evenings. Hopefully we can find something that works best.
That's wonderful. So if any of our viewers are interested in maybe becoming a hospice volunteer, how do they get a hold of you?
So they are welcome to either give me a call or send me an email with the information that's provided on the screen.
That's wonderful. And what if any of our viewers are maybe interested in learning more about hospice care? Can they connect with the McLaren Hospice team?
Absolutely. Our customer service line is also provided on the screen, and they are welcome to give them a phone call to help navigate through that conversation of hospice for a family member or for themselves.
That's wonderful. Like you said, it's a good conversation. Start it early, and what a wonderful service to provide.
Absolutely.
Yeah. Thank you so much for telling us all about the McLaren Hospice Program. Thanks for being our guest today.
Thank you.
Yeah. And thank you for watching McLaren Port Huron Today's Health Program. If you have questions about our program, please call us at 1-800-228-1484 or email us via our website at www.mclaren.org/phcontact. To order a free copy of the program and to access reliable health information, visit our website at www.mclaren.org/phth. As always, be sure to tune in next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.